With over 70% of residents in aged care facilities affected by incontinence, it is important to get pad changing routines and fitting right. Pad changing and fitting all starts with an accurate continence assessment to ensure a person's care plan is individualised and achieves their needs, goals and preferences. Individualised pad change frequency aims to maintain dignity and comfort with minimal disruption. This pad fitting video will help you to learn about the benefits of an efficient pad change routine, how to choose the correct pad style, absorbency and size. The benefits of an effective pad changing routine and correct pad fitting ensures comfort. Correct absorbency choice allows residents to sleep through the night, eliminating frequent disruption, minimising leakage, giving the person more confidence, a better sense of well-being and more time for carers to spend with individuals. It is important to follow a regular pad changing routine. We have prepared a pad changing checklist and the reasons for each step, ensuring your pad change is efficient and consumer friendly. Inform the person prior to the pad change. Reassure and inform the person of their continence care. Ensure privacy before you begin and throughout the change, and involve the person in the pad change wherever possible, adhering to their care plan and individual needs. For the complete checklist, please refer to the TCMS resources section. The kidneys normally produce 1,000 to 2,000 millilitres of urine over a 24-hour period. This means we void around 4 to 7 times per day, around 300 to 600 mils each time. Choosing the right style of pad is important to ensure comfort and quality of life. Think about lifestyle goals, mobility, dexterity, sleep and other factors. You can use the TENA product recommendation guide to get you started. TENA pads are colour-coded, so you can choose the style first and then the level of absorbency required. Some general tips for maximising pad efficiency. Use the wetness indicator. Do not put pads on too early at night, and prescribe the absorbency that matches the output. Each pad style is fitted differently. We will look at more common styles used in aged care. You can access all of the fitting guides via our TCMS resources section or via the TENA Professional website. TENA Flex is a modern incontinence aid that can be applied by the wearer themselves or by one carer. It is ideal for either those who require a high level of assistance and heavier incontinence. Fully open pad, and join the small Velcro tabs together. Shape pad into a bowl. Remove existing soiled product and apply perineal hygiene practices as per their care plan. Position the pad in the centre of the body around the waist height and align the wetness indicator to the resident's spine. Roll up and tuck the belt under the resident and roll the resident onto their back and secure the waistband. Pull the pad down and up between the legs. Stretch diagonally, left and right. Attach the tabs onto the belt, ensuring a close fit in the groin area. For toileting a mobile resident, the Velcro tabs can be attached to the back of the pad to keep it out of the way and then repositioned. TENA pants are ideal for people who are mobile and need an easy pull-up style that they can apply themselves and make toileting easy. It's also useful for those with cognitive decline and like the familiarity of an underwear-like product. Remove existing soiled product by tearing the sides from bottom to top and removing the pad from front to back. Apply perineal hygiene practices as per their care plan. From either a sitting or standing position, place the pad at the feet and pull from the front and back into position around the waist. Ensure leg elastics are fitted snugly into the groin. TENA Comfort is known as a two-piece product. It is paired with TENA Fix, which goes over the pad, ensuring a close body fit to assist with leakage protection. It is recommended for those with moderate to heavy loss who require assistance. Open pad and fold pad in half lengthways, shaping into a bowl. Pull fixed pants to mid-thigh. Place the pad between the legs with the largest area of the pad to the back. For males, this can be reversed, so the largest area is at the front. Roll the resident onto their side. Pull fixed pants from behind, then roll resident to position on their side. To reposition pad if necessary. Roll on their back, making sure the pad fits well in the groin area. Ensure the pad sits flat at the front and back. TENA Slip is a one-piece traditional style product, best used on those who are non-weight bearing and need full assistance and high absorbency. TENA Slip is easiest to apply to the resident whilst lying flat on a bed. Unfold the length and the width of the pad, shaping it into a bowl. Remove existing soiled product and apply perineal hygiene practices as per their care plan. Roll the resident onto their side, position the pad around waist height, aligning the wetness indicator to the resident's spine. Roll resident onto their back, ensuring the tabs are facing out. Pull pad down and up between the legs at the diagonal to ensure pad is positioned through the groin. Apply the tabs top to first to secure the pad. Pull rear leg barriers, ensuring a better seal. Angling the tabs allow for a more snug fit. TENA fitting guides are available on TCMS in the resource section. Please also refer to TENA Online Learning for modules on pad changing and change frequency. Your TENA Continence Management Consultant can be contacted via your TENA coordinator. They can help you with product choice, fitting and other continence management concerns. Or call TENA Customer Service for further assistance.